Good afternoon and welcome. We're so glad you could join us today for our webinar on differentiating and selecting evidence-based programs. This is part of our webinar series, and it's third in the series. We hope you will be joining us for future webinars as well. So I'm going to move us along. I'm Jessie Watrous, and I'm with the Institute for Innovation and Implementation, University of Maryland School of Social Work, and I am joined today with my esteemed co-facilitators, Suzanne Kearns, Bob Franks, and Rosalind Bertram. And thank you all for joining as well. And we are all here today representing our organizations as well as the Child and Family Evidence-Based Practice Consortium. This is a wonderful group of implementation specialists, program administrators, developers, practitioners, and researchers that are promoting best practices for implementation and workforce development in the field of child welfare. So we hope you will, we have a website we can share with you later on in the presentation, and you can check us out. So what we'd like to do first is just remind us of our overall goals for the series. So what we're hoping to have and be able to offer you is the ability to learn how to build the capacity and strengthen your service array to meet system improvement goals. So ultimately, all of this is in service of improving outcomes for youth and families, addressing inequity and eliminating disproportionality and disparities, building and strengthening the partnerships that it takes to have success in those areas, and changing how we often practice to include youth, family, and community in decision making. So I mentioned that today is the third in our series, and we have 3 more upcoming. The next one's going to be on building the partnerships and infrastructure for high quality implementation of EBPs at scale. Then we're going to talk about funding and financing strategies for EBPs at scale. And then last is the practice changes, really at the level of matching services to children and family needs. So we hope you'll get online and register for those. Thanks. So, and what we hope you'll get out of today is the ability to walk away with a good orientation to how you go about assessing the needs and the gaps within your system of care and assessing the fit of programs and practices to your local context. So we're going to share the results of our poll. So if people can respond. The question here is, what role do you play in service selection? And so we know we have usually a diverse group of folks that attend these webinars, and we'd like to get a sense of who's represented. And a lot of us wear multiple hats, so feel free to choose more than one. All right, results are coming in. All right. Okay, so we have a good diverse group here. We have practitioners of services. So, and you can think of this often in the space of child welfare. That might include case managers in the area of more on the service delivery side. We have therapists and program practitioners. In education, we have teachers and then supervisors of those services. We have administrators of services, and we have funders and purchasers of service. And that language I know can be a little confusing, but it's really the idea that can include everything from your government organizations that partner in delivery of services to your private funders we're all, many of us, I hope, see ourselves as the community that might be receiving some of these services, as well as the families and the family and youth advocates, technical assistance providers, as myself and my colleagues are, as well as researchers. And then we have some folks who wrote other in the chat. I'm having difficulty seeing the chat, but that's okay. We'll come back to that. Thanks so much. All right, so the reason we asked that question here is that we want you to know that we all have a role to play in the process of assuring the fit of an evidence-based program. And so as funders, there's a powerful role in often highlighting evidence-based programs in general as part of a funding strategy, and then often sometimes specific evidence-based programs if they've done that in partnership with community and systems. Communities and systems are engaging all the time in the process of strategic service array development, nationally and locally. Program providers, so at the agency level, so your nonprofits, you often have a chance to adopt a new program, sometimes in response to funding opportunities, sometimes as part of your strategic plan development. And then youth and families, when we're seeking services, have some of the most critical role in many ways, and letting your partners, often your care coordinators or the practitioners that's serving you, what works for you in terms of services. And last, technical assistance providers and researchers are going to help us identify and apply the lessons learned about what makes a good fit. Key question, and sort of this tees off where we ended last webinar, which is asking the question about when developing, doing a needs assessment, which is what we covered last time. It's really critical to think about who is at the table when you start the process. Who is asking the questions? Because so much of this is really defining the scope of your effort, and that often really can be shaped by who's at the table. So I'm going to start actually with kind of big picture, and which is strategic service array development steps, because where we're going to end up today is helping you work through the activity of really identifying the characteristics that you would like to see in the programs that you're selecting and using, and assessing the fit of those programs. But before we move into that, we're going to have to look at wanted to kind of remind you or get you oriented to the big picture steps around strategic service array development. And just to kind of remind folks, we've touched on this in past webinars, but the key piece is really developing that shared partnership, or the partnership to begin with, where you can develop shared goals. And so that partnership, it's critical to establish, kind of what are the shared priorities. It's really important to base that on data, and then include the communities that you wanted to see, that your partnership wants to serve in that decision-making process from the start. The next piece is really doing some work around identifying the service array gaps. So none of us want to approach this work of, there's a lot of good work to be done, and I don't think our intention is to basically put a lot of energy into areas where we have existing services that are meeting existing needs. What we want to do is identify gaps as a place to start in the process. If your system feels like it's got a range of services to meet all the needs and filled all the gaps, then okay, maybe one of those gaps you want to look at is more of the evidence-based. But I really suggest that you start by thinking about your gaps in your service array in general, and by meaning specifically the type of services, the availability of certain kinds of services, access, and quality, which really often will involve evidence and performance indicators to understand, as well as qualitative information to know if the quality of those services is what you want it to be. So that's part of your gap assessment. And this is something the Institute, as well as our technical assistance partners, have done with systems and communities all over the country, where you often just begin with really an inventory of those services that exist and help them identify who they serve, where they serve, individuals and so on, and then do the analysis to identify gaps. That kind of information can help you refine your strategy about the kinds of services that you want to bring into your community and into your system. And once that's established, you can really start to dig into the idea of what are the characteristics that and your own capacities as an organization or a system or a community to be able to deliver the evidence-based program or service. And so I think that walks you through the 3 buckets on the slide. You'll notice at the bottom there, we have your financing strategy, because quite frankly, the financing strategy can be brought in at each of these points. Often when you start setting your table and defining your goals, that's often in response to a funding opportunity. It certainly doesn't have to be, and it probably is done best when it's not, to be frank. But then as you go and you identify the service types, you can really you want to identify your financing strategies as you go to say, okay, these are your gaps in services. These are the type of services that you want to implement. These are the EBPs you're looking at, and what are your possible funding mechanisms to do that, to fund those EBPs and services. All right, going to keep moving. So we're going to kind of transition now into the kind of next level of developing your service array, which is really looking at the EBP fit. And one of the things this slide calls out is that in that partnership, every partner is bringing to the table their own sort of particular context, their own needs, their own goals. And so that's why it is really important to be establishing shared priorities from the very beginning and throughout, so that those things can be all put onto the table and be part of the conversation when you're assessing fit. So considerations for fit, key piece. Is it responding to the needs that I have identified? Is it going to help you achieve the outcomes that your partnership has identified? Evidence-based. There is every day, we are investing more and more into evaluation that allows us to expand the evidence for services that are effective in serving children and families. And so this series really is encouraging you and preparing you to utilize evidence-based programs and practices in service to your goals. And we want to make sure that in part of that process of that assessment of consideration of fit is understanding the cultural and linguistic, what the experiences of the people that you're serving, as well as the system and service priorities. And we'll talk more specifically about that. That can be a range of things. And one of the things we call out in the example later is ensuring that programs are able to address all the diverse languages that people speak in our communities and with the program materials they provide. So that's just one example. And the other last piece that you'll probably hear us talk about so much is the implementation supports. And so that's going to be something when you're looking at the fit of a program, you're going to really want to dig into and understand what is available to ensure that you are prepared and supported in implementing that program with fidelity so that you can get the outcomes that the research has shown. And the next big piece is looking at your own capacity. The capacity of, if you're a referring agency, your capacity to serve on implementation teams. If you're a program provider, looking at implementing the program, really taking a hard look at the staffing requirements, the data requirements, and we're going to talk more about that. So what's the process? Just so people like lists, I find, and tools that can guide them. And so we're going to walk you through a specific tool. But in terms of the process, the first part of it really starts with sitting down, if you're an agency, and understanding your own requirements, and by looking at the considerations that we're going to highlight even more in more detail. The next piece is, okay, you've got your requirements. How do you start to understand what might be available to you? And so there's some resources I wanted to highlight for you to be able to do that. The first is the clearinghouses and directories. We are blessed now with a variety of clearinghouses tailored to kind of different communities with different scopes of services that are included. And so that's a great place to start to develop a short list of models for programs. The other piece is really, I think maybe sometimes underattended to, is that if you've done that strategic service array development, you ideally will have a good sense of the evidence-based programs that are already being implemented in your community and in your county and your state. And so that's often a place that people want, just it's really important when thinking about program expansion to understand what is currently being delivered, and specifically, is this particular model being delivered in similar communities to yours? And that can be, specifically in your community, as well as we'll talk about more. I think another piece that's really important to do if you're digging into this is try to find out where the programs have been implemented and talk to those individuals. So who are implementing the programs. So in terms of narrowing from your list to your short list of programs or models, you're going to start with your purveyor materials. So your purveyor is the training and quality assurance entity that disseminates the programs and models. And they have materials that are going to be very helpful in your exploration process. The next piece I would recommend is direct communication with purveyors. They're often available to answer questions. And the last piece I would suggest is if you're a state or county, you might want to look at other states and counties that have implemented those programs and get a better understanding of their experience implementing. And the last is really making your decisions about your service selection. Okay, and we have one more poll we're going to ask you. We want to know a little bit about, what's your experience using resources to learn about evidence-based programs. What resources have you used? So look, wow, fantastic. 100% there for a minute. Okay. Give it another minute. Make sure everybody give us a, if you want to enter into the other, let me see if I can figure out the chat. All right. So about half of you all have used at least one of these, which is fantastic. And and I'm so glad actually that there's some affirmation there on the idea of talking to people who've implemented the program. I don't know, we'll have a little bit of a conversation later about what else, what you look at in the program selection process. And I think we can also reflect a little bit about what's been helpful in terms of understanding the models available. So we see, people are using clearinghouses, they're using the websites, they're talking to folks, and a small portion of you here today haven't used those resources. So I feel like we can offer you something new to explore. This is just a slide, and maybe we can drop some of these. It's a slide with the directories or the clearinghouses that you might search if you're looking for programs. And as I mentioned, they're sort of the clearinghouses are tailored to different types of programming. So we've kind of organized them by type of programming. Many are cross-cutting. I think Blueprints is one of them. It's probably most cross-cutting, but I encourage you to check those out. And that's going to help you. And as I just wanted to highlight, that's going to help you really develop your short list of programs that match your requirements that your partnership has identified. So before we jump into, I'm going to now jump into basically an example of how we provide you an example. It's really been my experiences based on a lot of our work in Maryland, and I'm going to share that with you. Before I jump into that, though, I needed to just give you a little bit of a quick primer on one of the things that has created a real opportunity moment for child welfare nationally and certainly in Maryland, where I'm working, and that is the Family First Prevention Services Act. And so what it does is it really puts some kind of parameters around out-of-home placement that ensures that out-of-home placement is addressing the treatment needs of youth. That was a key piece. And then, let me back up for a second. Family First Prevention Services Act, what it does is allows states to use Title 4E funding differently. So it's typically been used to fund out-of-home placement and child welfare. That's how it's only been allowed to be used, really. And now it really opens it up to be able to be used for prevention services while putting these parameters I was just talking about on out-of-home placement. It also expands the age that CHAFE funds can be used and allows the education training vouchers to be used up to age 26 instead of 23. So it gives states that kind of a real opportunity. I think the key piece we'll highlight today is to invest in prevention services, which is very different than how we've, while there's been funding for prevention services for decades, this creates kind of a new way of using Title 4E funding to fund prevention services. Those prevention services have some really important parameters around them as well, though. They really have to be used for youth and children at risk of out-of-home placement. And then they have three buckets or three types of services that they allow us to fund, which are in-home skill-based programs, mental health programs, and substance use programs. And they all have to be evidence-based, and there's very clear categories of evidence, and that is all defined, and those programs that are allowed are identified on the Prevention Services Clearinghouse. So you can learn more about that. That was the quickest version of Family First Act I'm able to provide, but there's so much more you can read and learn about. So that just gives you a little background on the opportunity for Maryland, okay? And I'm going to talk now about kind of how we've applied that opportunity. So what in Maryland's state plan, under the mental health area of services, we've identified parent-child interaction therapy, multi-systemic therapy, and functional family therapy. So that's just three of the therapies under the category of mental health programs. And those programs were identified by the state in partnership with locals and technical assistance and community. There was some input in that regard, but it was really based on the areas where the state already has significant traction in terms of delivery of services. The next piece, once the prevention, so those were the programs that were proposed in the state plan that were mental health programs. Those were approved. And now the state is engaging in a process of saying, okay, where do we expand those services or start those services? And then, so there's been a next step process of engaging local office, child welfare staff, and leadership to determine which of those programs need to be available locally, and really how much of, how many of those, how much of it is the need for those programs locally. So the local offices have kind of used a process of looking at data to determine the need and doing a service array gap analysis to determine if there's a gap to fill in terms of services. They've not always systematically, but in many counties done a really great job of engaging community partner input. And ultimately, for this example, we're going to talk more, is trying to assess specifically whether, based on their need, PCIT is a good fit, and many of them have. And then we're beginning the process of really the procurement process, which is the next step of the process, which is where you get, program providers are going to have to assess, if I'm going to respond to an RFP, for example, if that was the procurement process, what would I consider in terms of my own agency's readiness to respond to an RFP to deliver this evidence-based program? So that's what we're going to jump into next. This is just a kind of a visual that shows how that example is applied to the kind of best practice steps I'd outlined before. So the agency was focused on decreasing child abuse and neglect and preventing out-of-home placement. The data, and this is from working with one particular county in the system, showed a significant number of children under the age of 7 years old with mental health needs or really challenging behaviors. And so for Maryland, when they're talking about, one of the things that Family First really asks us to do is to find candidates, particular language, but it's basically the people that would be eligible for services that are claimed under this funding source. So looking at that population, they defined it largely as children receiving in-home services. And they looked at that in-home services data and saw that this is a primary need for children who met that candidacy definition. Then they engaged, as I mentioned, in a service rate inventory, looking at some existing services to meet that need of mental health needs for children under 7. And so that kind of helped them prioritize that partnership goal that we talk about in terms of meeting those needs. And then the next piece is starting to think, really transitioning to say, okay, if that's our need and this is a gap we've identified in our service array, what's important to us in terms of priorities for selection? And just a couple priorities, we're going to get more into detail, but is supporting existing community-based mental health partners. So, Maryland is very rural in many places, and, a key piece is bringing evidence-based programs to the existing mental health agencies. So something that mental health agencies could easily adopt was a key priority for them. All right, so that hopefully folks have a kind of a picture of how this all works together. And I'm now actually going to give you a tool. So, and I'm offering you a tool that it was actually sent out in advance of the webinar. You can find it here on the Child and Family Evidence-Based Practice Consortium website. The tool has 2 parts to it, and it helps you first really focus on what are your partnership requirements. And by requirements, that's sort of what you're looking for, sort of the characteristics in the program or model that you're looking to adopt, as well as your own partnerships capacities to take this program up. Oh, that was one thing I didn't mention earlier in terms of the priorities. I actually skipped right over that. But in terms of capacities in the Maryland, when we were having the conversation about the Maryland priorities, one of the county's priorities was about feeling like they couldn't do too much at once. And I think that's a very real and good kind of approach to this, is saying, okay, they have to prioritize along the way. And so they were actually looking in part of the selection process was just looking to start with 1 EBP to start out. So that's, it's kind of inherent in this process, but kind of defining those big picture priorities is where you start. And then getting into a lot of the characteristics. But the reason I mention that is because it really has to do with the capacity of the organizations at the table. It's a time of COVID when we're implementing this, and there's a lot of things going on. So that was one of their own assessment of capacity, and that's a really important piece of this puzzle. So I'm going to jump in and give you a little, again, continuing with our example of kind of how this works. So these are basically the first part of the template helps you look at the requirements, and so we use this template essentially captures the information that the partnership looked at. So I already talked about the focus population and the outcomes. The other piece about outcomes is that it was really important to the partners to be able to, they're really interested in looking at mental health interventions, particularly with young kids, that, the youngest of children, that work with the parents, that help the parents develop the skills that help maintain that child in their home over the long term. So that was an important kind of value and, just good sense strategy they brought to the table. The other piece is we have to ask themselves, well, what are your own data requirements? Because all evidence-based programs are going to require data collection, and implementation teaming requires looking at data on a regular basis to ensure that you're getting the results you want. So you have to ask yourself about your data requirements. And another real honest piece was that there really isn't, for most of the child welfare agencies, county level, they don't have much data collection and reporting capacity. And then honestly, in the mental health agencies that are likely to respond to the procurement process, there's also very limited capacity. So Maryland, like many states, have brought in technical assistance like the Institute to provide through a contract that data reporting and collection expertise to help that implementation process. The next critical piece was looking at language and culture. In Maryland, we have, the biggest non-English speaking population is Spanish speaking. So it was really important that program materials be available in Spanish. So that was just one aspect of looking at culture and language. Staffing expectations in this case, because we're looking at the capacities of the partnership, the child welfare agencies at the local level were saying, okay, what's our capacity just to do good partnership? And that, means, as we've defined it, having a lead for an implementation team. And so we've tried to really have honest conversations about the time that it takes to have that implementation team leadership, where you come together with the referring agencies, the funders, the program providers. And they also, as they can look back to their inventory to know that they had, in this case, 6 community-based mental health agencies that had the capacity to respond to an opportunity to deliver this mental health EBP. We talked about service modalities and formats and locations. And so one of the things we did talk about in terms of looking at mental health services was the desire to have in-home services. But in this particular county, there was an acknowledgement that there's also good community-based and clinic-based mental health agencies and good public transportation. So that was, they were certainly open to clinic-based services. We kind of talked about intensity of services and felt like for their families, weekly therapy sessions would probably be the right amount of intensity for that candidacy population. And just the next piece is looking at coaching and supervision. So a key thing often, when you're looking at mental health programs in particular, a lot of ABPs, is how you start them up. And you need to stand up a whole team of therapists working together in the case of MST and FFT, or can you train an individual therapist? And so this county really was feeling like, given that population need, they were looking also for a program that allowed for individual therapists to be trained. In terms of funding, we've already talked about the fact that this whole process actually was created out of that opportunity moment that Family First brings. And so in addition to utilizing Title IV dollars for ongoing services, there's also an additional funding source that we refer to as the Transition Act that you can find out more information about. But that allows for, in Maryland, that's dedicated to providing dollars for training to start up evidence-based programs. So that's something you want to think about, is what is the funding that you have available as you're engaging in your selection, and will it allow you to start up and sustain the programs you're looking at? And the last piece, and sort of an other piece, is that this county mentioned that they have strong community school partnerships. And so being able to utilize or select a program that could actually be done in conjunction with community schools was an idea they felt would be a really great way to kind of focus the services on the communities where youth are most at risk, the children are most at risk. All right, so just kind of, I want to move us into an exercise pretty quickly here, where you're going to get to talk about kind of what's important to your communities, your systems, your agencies, and selecting evidence-based programs. but I wanted to show you the second part of this tool, which is where it gives you a nice template to rate as a partnership the fit. So those are your requirements. And we've talked about the idea of the resources you can look at to be able to identify kind of the characteristics of a program. So you could look at, for example, I'd suggest, well, in this case, we looked at the Prevention Clearinghouse and what it talked about in terms of parent-child interaction therapy, and tried to assess, okay, does parent-child interaction therapy, what is described, how it's described on this clearinghouse, does it match the requirements that the partnership had set out? And so they felt like it did meet the match in terms of focused population, identified outcomes. They felt like there is, in terms of the data requirements, a lot of the data requirements are actually on the provider level, so those could be built into contracts with providers as well as technical assistance. So those things could be met. They were, pleased to find out that parent-child interaction therapy has all its program materials in Spanish, and it's been evaluated with the Spanish-speaking populations and found to be effective. And this gets to the next piece in terms of, but right now where they are in this point in time in terms of selection is that they also prioritize in the next step ensuring that a request for proposals, or however the procurement process was handled, it prioritized hiring or choosing an agency that was committed to hiring Spanish-speaking therapists. And last pieces we've talked about, the PCIT was able to fit all the other requirements that they identified. So that tool hopefully will help you look at all those things in kind of a systematic way, which can be really important when you've got a lot of if you do it right and have diverse partners at the table, kind of giving some feedback and input, you're going to have different points of view about fit. So utilizing a tool to bring everybody together and set that shared framework, it can be very helpful. So last thing I mentioned was clearinghouse. I also want to mention, so we sent out in advance of the webinar 2 kind of one-page documents that give you a snapshot of parent-child interaction therapy. And that's the kind of thing like we've been able to provide as part of the technical assistance that helped the agencies make some assessments of the fit. And one of those documents is a logic model for parent-child interaction therapy, because it really breaks down a lot of the characteristics we've just reviewed, as well as a one-pager that summarizes a lot of those characteristics. But there's many, many, many more materials you can access. So we are going to move you into breakout groups, and we have some fantastic, I talked about our co-facilitators for these sessions. Really, they're each experts in the field, so feel free to ask them questions directly in your breakout groups. But what we want you to do is tackle the questions of what are important considerations for you in the program selection process? What do you feel like's been missed, or anything that you wanted to add in terms of what we might want to kind of add to our consideration list? And also another piece is that I think we're trying to encourage more conversation about is how do we ensure that all along the way we're promoting addressing equity. And I think at the program, I started off this webinar by talking about all the opportunities to match, to assess, fit, and match. And I just wanted to encourage you to think about how in that assessment and matching process, you can also be meeting the goals of addressing equity. So those are a couple questions to tackle. I'll let you break out into your questions, and if you can come back, break out and tackle those questions, and come back with 1 or 2 highlights to share. So thank you, and here we go.
All right. Hello, everyone. I'm assuming we have most of our groups back. I'm just going to go ahead and just have everybody report out quickly. My name is Bob Franks. I'm working with Jesse on this series. I'm just going to facilitate a little discussion about our breakouts. I will start and then turn it to our other co-facilitators as we move forward. I see they're joining us now. And I'll start by sharing that we had a very quick discussion. It went by very quickly. A couple of the salient issues that we talked about were sort of utilization and uptake of the EBP. And one of our participants talked about the challenges associated with utilizing the EBP during COVID, whether or not it can be easily used by using telehealth, which is an important consideration. And then we talked about the ever so important consideration of cost. And I think the cost discussion is a really important one, both in terms of the initial implementation and sustainability, thinking about where that cost is coming from, multiple funding sources, and how you message that, how you get people to buy in to making the investment, and communicating about the long-term benefits. So I will turn it over to Rosalind. Rosalind, would you like to report out a couple key themes from your group? You're on mute, Rosalind. Just unmute yourself.
Apparently, when you change rooms, it automatically mutes you. At any rate, we had a number of different concerns, but they weren't as specific as within my organization, what do I need to think about? They were much broader. They were questions about what's evidence-based and how do we negotiate different clearinghouses having different criteria. Not everyone was necessarily pursuing selection of a program through FFPSA. And there were questions about, well, if we do go through FFPSA, we want to bolster our attachment theories, interventions, and what if it's not there? And honestly, we did not get to the bottom of any of that. We only had enough time to kind of explore the parameters. So that's a quick rundown of where we were.
Great, thank you, Rosalind. Sue, how about you?
Yeah, I think likewise, our time went really fast. We kind of broke ours into a couple main areas. One is flexibility of the evidence-based practice. That was consideration for selection, and a couple of members in the group were talking about just, some EBPs that differ on kind of the, extent to which relational factors, including different family members or, these types of things that we know can be really important are. And so they want to make sure that they have a good sense of that in their selection process. And also fidelity. I think how practical the fidelity monitoring is, as well as that kind of space of flexibility and fidelity, and like how much flexibility is allowed within the programs to meet the unique needs of a particular area. And then we had a discussion about equity as well, and kind of where that role is for EBPs, and making sure that that they pick is culturally responsive, and wanted to really extend that beyond just like linguistically competent, but really able to address disproportionality in the system. And that could happen based on how programs are able to be paid for, if they're like only available through Medicaid, or there's certain things like that. And also we had a discussion about technology needs that are attached to EBPs and how that could present unique problems in certain geographies or for people with certain economic situations.
That's great. You covered a lot, Sue, in that 10 minutes.
Hopefully I did justice. If I did, anyone pop in on the chat if I missed something important.
That was great. So, and then finally, Jesse, how about in your breakout?
A lot of what's already been said, but really matching youth and family needs to the EBP. So thinking about at that level, and also ensuring that when assessing for cost, really interested in cost, but thinking about kind of like almost like hidden costs, like care coordination time, case management time, how that can vary based on the program. As well as just the other types of program implementation costs and training costs. And in terms of equity, we talked a lot about, we talked about the idea of sort of building up cultural competence of all the staff that are working in the agency.
That's great. Thank you. Just a couple comments just to wrap up. Obviously, we covered lots of different topics in our breakouts. I know we could have spoken for a lot longer. These are complex issues. There are not always easy answers, and I think it, really requires you to tailor this process to your own jurisdiction, your own community, thinking about your own needs, and to really, you can utilize the tools that we provided to really help you, think through some of these questions. But a lot of the questions that we even talked about in these short breakouts are the big things that folks are struggling with. One note I do want to make is that, there are resources out there. We've identified them. Other folks have already gone through this. Intermediary and purveyor organizations have done a lot of this work with states. In some states, there's large penetration of evidence-based practice. So there are folks that you can turn to, and you don't have to start from scratch, even though it can often seem like there's a lot to consider and not to be sure where to start. So thank you so much, everybody, for your input, and I'll turn it back to Jessie.
Well, actually, Sue, you've been monitoring our chat. People have, I actually didn't encourage folks, but hopefully they have answered questions. I'm going to see if you could pull out a couple for us.
Yeah, I mean, I think most of the questions have been answered. The one that is lingering that we haven't had a chance to address in the chat is if a provider in Maryland finds another evidence-based program that isn't currently on the FFPSA list, I'm assuming that's what that one is about, because it was about FFPSA service array. Could another program be included?
So I would say, states have an opportunity to create a state plan and choose programs that they want to include in the state plan. Those programs on the state plan, there's a process. They have to meet criteria laid out by the Children's Bureau, and including being listed on the Prevention Services Clearinghouse. There is a mechanism to include programs that aren't on the clearinghouse, but requires a lot of evaluation. So that's kind of how states have handled it. Once the state plan is approved, those are the services that the locals then have the option to utilize in their local service array. That does not mean that there's not other excellent services out there, and there's not many other funding streams. So that example, I hope people will take away, is just knowing that that's just one funding stream for supporting a couple programs. There are many other funding streams and other good services.
Thanks, Jessie.
Should not be limited.
Yeah, I mean, that's all that we had in the Q&A, I think, that was unanswered. If that's wrong, though, please go ahead and put it in the chat. But I think there was a lively discussion in there about the different clearinghouses and those pieces as well. I think some good resources were shared, and I would encourage people to look at the chat and look at the opportunities for downloading or going to different websites to get more information there.
Wonderful. Okay, so we want to close us out. Thank you for everybody's participation. Want to encourage you to join our next webinar. It's going to be on the infrastructure that you need to kind of stand these programs up and sustain and do it with fidelity at scale. And we also would like to encourage you to watch out, check out, look for an opportunity to have a certificate in focus. It's a care coordination model designed for frontline staff and supervisors to enhance their skills around care coordination for child welfare, juvenile justice, and behavioral health workforce. You can learn more there by clicking on that link that we're putting, I'm sure we'll put in the chat. So we hope that you'll check those things out and come back and see us again. We'll have different presenters each time, kind of mixing it up among our group here. But thank you so much, and I hope you have a lovely day. Thank you.